Oh, okay. Alrighty. So, what I was talking about yesterday was, oh, that's right. We were talking about tracheotomies and a lot of that medical related jumbo about COVID. So, that's from numerous conversations I had with my doctor that I had over summer. A lot of those complications that you can get from COVID is like inflammation around the heart. You can get depression. You can also get paralysis of the foot. I don't know if I pronounced that correctly or not, but what it means is you don't really have feeling in your feet, and sometimes you can also get drop foot syndrome in both feet. And unfortunately, I have drop foot syndrome. It's starting to come around. I can walk in that at least, so other than I need the assistance of a walker and a cane, but I do get around. So I just have a hard time keeping balance. Well, I got it. And yes, I did get a haircut last night, so that's all good there. So basically, there's complications. You can catch Guillain-Barré syndrome from COVID. There's other complications. You could possibly go blind, or you become a vegetable, or you'd be stuck in a nursing home because you couldn't do the daily basic care of like taking a shower, brushing your teeth, feeding yourself. Or you'd be stuck on a feeding tube permanently. I was on one for about at least 6 weeks. But it is what it is. I'm alive. I'm well. I do have to go for a chest x-ray in November to find out if the lungs are scarred. But, things could be a lot worse. So, the next topic that we're going to get into is rehab and that I was on oxygen, even though I wasn't on a mechanical ventilator, but they did something called a trach collar, where they still gave you air, but they also gave you a breathing treatment to go along with it. And what it was is just basically humidification. And it was a device that got hooked up to an oxygen sensor. Not an oxygen sensor, but it was hooked up to an oxygen line. And it put humidification into the trachea tube. That's kind of what it looks like now. But it's actually a lot healed up because I went to an ENT specialist down in Milwaukee just to verify that it was all right. And to him, it looked pretty good, so I'll take his word on it. His colleague actually put the tracheotomy in So he knew all about what had to be done in that, so that was good. And on as far as rehab goes, not only do they have to wean you off of being on a ventilator, but for me, it actually wasn't that bad. It didn't. After about 3 days of being off of it, they determined I was well enough that I didn't need it anymore. So they took it out of the room, and I was excited about that. And then they were at least able to. They dropped me down to 2 liters of oxygen. So I was on a nasal cannula for at least 2 or 3 weeks after getting it discharged from the LPAC hospital. And the reason they call it LPAC is that is a specialty hospital for cases like me from recovering from COVID. In that kind of place, they wean you off of, like on a ventilator, they get you eating solid foods again instead of being on a feeding tube. There's a kind of formula that I was getting was Neprin or Nepro, or it's very disgusting. And I was on heparin, and I was on quite a few other antibiotics. And another thing with COVID possibly is hair loss is something that you may experience. That's what the doctor was thinking anyway. So I almost went completely bald for a while. But a lot of the medicine that I was getting could have also affected that possibly. So it is kind of a very interesting experience when I was at the first place, or medical college. I was on quite a bit of morphine and oxycodone and Vicodin, and note to self, if they withdraw you too quickly, things will happen, and you'll feel it, and it's not that pleasant. So between all 3 of those drugs, it's kind of potent enough to be as strong enough as legal contraband drugs. But it is what it is, and life is interesting in that aspect. So the other topic that we'll get into is, once I was discharged, I did end up going into a nursing home for about 2.5 months / rehab center. And basically the main things that physical therapy and occupational therapy worked on was like fine motor skills. And what fine motor skills are, it's like working with your hands, doing standing activities, working on balance, like swaying your hips left to right, backwards, forwards, without falling down. And yeah, it wasn't easy. They did a lot of walking or use a 2-wheel walker, and the goal was to exceed 150 feet. And well, first, before they even do that, before they have you do that, they have you walk on the parallel bars, and before they started doing that with me, my roommate that I had, he was kind of egging me on to, he's like, go, Dom, go. So I did. Well, at the time I was kind of wheelchair bound. And we'll get into that in a little bit. But the interesting thing was, so I started on the parallel bars without a physical therapist behind me with a gait belt. I was just walking to the other side of it and back, and boy, did I get my keister chewed out and handed back to me for doing that. And I know I shouldn't find it funny, but I still do. Well, that was kind of interesting. And then after that, then that's when they started doing the parallel bars with me, and then do walking. Then eventually they determined I was strong enough so they put me on a walking program with certified nursing assistants, and most of the time they were short-staffed. I'm not blaming them personally, it is what it is. But it was hard to get a walk most of the time. And I could tell there's certain ones that wanted to walk in and there's certain ones that didn't. And that was fine. I just carefully timed when I would do those walks. So, and they even made, or therapy even made me, or appliances for my feet called AFOs, which are leg braces. But it's like a one-size-fits-all kind. You can get them on Amazon for like $35 for like a left and a right. They don't really fit that well, and they're not that comfortable. I should be wearing them, but I don't really use them. I should actually go see an orthopedic specialist for a better fitted pair, but I don't know if the insurance is going to cover that. Technically, the insurance didn't cover these. So, and I'm not really that rich to actually afford to pay thousands out of pocket for a nice fancy pair of AFOs. So, I'm going to go to the chiropractor and see what they can do about drop foot syndrome and see and go from there. Sometimes your facial hair gets kind of itchy and you're growing it out. But another thing that they'll do with you is the TheraBand exercises to strengthen your biceps and your upper half. So it's pretty fairly straightforward. It's not that hard to do. So it is what it is. Yeah, don't you hate when your head is kind of, it's... And I did meet a lot of interesting people along the way. A lot of wonderful people. Not so much residents, but I never really related much with the residents of the home. I was more closer with the employees than I was with the people there. Not that I had anything against the people that were residents, but for being 25 years old, you don't really have a lot in common with people that are 70 or 80 years old or 40 or 50 years old. So you tend to have more in common with the younger people for your age group. So, and in a way, that kind of inspired me to take the TNA course and CNA stuff. Well, actually, I still got to do the CNA stuff yet, but as far as taking the temporary nursing tests online, a lot of those people there kind of inspired me to do that. So it's all good. Yeah, I just like tend to have a lot of itchy skin, but so basically for about 2.5 months, almost going on 3, that was, I wouldn't quite say agony, but it kind of felt like I was in limbo as far as getting home. So for the most part, I was pretty independent when I was there. I was able to do most things, not right away, but when I first got there, I obviously you had to use a bedpan and that because I wasn't up and walking. And I'll just put it this way, it's kind of gruesome, but it is what it is. And as far as I found, once I was up and doing more therapy and stuff, a lot of the pressure sores and ulcers on my backside from being bedridden for 2 months started clearing up, so that was good. Because a lot of the places I was at, they had CPR pumps on the bed that would alternate it so you didn't get bed sores, even though I still did anyway. But the last place I was at, that I'd have to say that was probably one of the most uncomfortable beds I've ever slept in. Felt like tubes running across your back side. But at least I knew I wasn't going to be there that long, so it wasn't too bad. And even as far as like wheelchairs and that go, if you're going to get fitted for one, make sure it's comfortable. I don't need one anymore, but for about 2 months I was using one. Because I wasn't determined safe enough to be up walking. Because my luck, I would have fell flat on my face and probably fell flat on my back or fell into something. I was very unstable walking, but and if you do spend a good amount of time in a chair each day, You want to make sure that you got the right seating equipment and back support, or you will get pressure sores. Not only that, but you just get kind of uncomfortable. So, I'm not really an expert on that kind of stuff in particular, but if you want to learn more about it, there's stuff on YouTube about that stuff. I'm not really qualified to give you advice on that kind of retrospect, but I've had experience with having to deal with some of the inconveniences of that stuff. But towards the end, like at least 2 to 3 weeks before getting discharged, I was up walking most of the time with a walker and a cane, so that was pretty good. So that was physical therapy and occupational therapy are very interesting, in my opinion. I got a cousin that's a physical therapist, and then I got another cousin that's a agency therapist. Then I had an aunt that was a occupational therapist. Well, I hope you enjoyed this little montage of information. We will do a stream in a couple of days. I think probably either Thursday or Friday. So take care, everybody. Bless you all in Jesus' name. And we will see you soon.